Welcome back, dear viewers, and now on Good Morning Kuwait, as you are used to, it is our conversation segment where we are going to host a lovely guest, very wonderful, with a lot of information. And as you all know, cancer treatment has witnessed remarkable advances in recent years, and one of the most precise and promising approaches today is nuclear medicine. This field specializes in and plays a vital role not only in diagnosing cancer, but also in delivering targeted therapies that help treat disease while minimizing damage to healthy tissues. Now, to help us better understand how nuclear therapy works, its safety, and its impact on patients' lives, we are pleased to be joined today by Dr. Abdulredha Esmail, Head of Nuclear Medicine Department, the Kuwait Cancer Control Center, who's going to shed light on how nuclear medicine is transforming cancer care. So, welcome to the program.
Thank you so much. Good morning, Kuwait.
Good morning, Kuwait. Yeah. I am going to ask you, and this is out of personal curiosity, nuclear medicine. That is, for me personally, it's the first time I've heard about it. So can you elaborate more? What is that?
So, first of all, nuclear medicine comes from the two words. There is a nuclear and there is a medicine. So the word medicine, this specialty is part of medicine, which uses radioactive materials, and these radioactive materials, they come into different form of nuclei, and they emit a sort of radiation. Yeah. These radiation, we use them in order to diagnose or treat patient, depending on the condition that we want to image and diagnose.
So, what kind of treatment are we talking about when it comes to nuclear treatments in terms of cancer patients?
In terms of cancer patient, nuclear medicine, when it started in the world, started in the 50s. It's even earlier, but with the therapies, it started in early 40s, 50s. And we started nuclear therapies in Kuwait from the 1960s.
Oh,
we started, first of all, with radioactive material called iodine. And this iodine is a special form of iodine. It's not the iodine, the salt that we use. It's a different form of iodine, which has a radioactive materials, and it targets thyroid cancer cells. And these thyroid cancer cells, they behave in a way that when they concentrate the iodine inside them, the iodine, which is the radioactive part, emits a radiation, and that radiation causes cell death. And this is the aim of all therapies that we are targeting the cancer. We want to kill the cells by a sort of either toxic materials or radiation.
Now, you also mentioned throat cancer. Is this kind of treatment specifically for throat cancer, or is it, all kinds of cancer?
Now, it depends on the other part of the nuclear medicine, which it is a little bit more specialized. Now, we use a radioactive material, and that radioactive material is bound to a different form of medicine. And depending on the target or the tissue or the disease that we want to image or treat, that part of medicine will go to that part, and the radiation will do its job by killing the cell. So, for example, the iodine, if we give it as a free iodine, it will go to the thyroid. But if we put with the iodine another medicine, that medicine will go to a different type of cancer, and the iodine will do its job as a form of radiation and kill the tumor. By this manner.
Now, speaking of killing the tumor, because I know there's a lot of associations between the word, nuclear and negative effects or harmful effects, but I know from your talk that this is relatively minimizing harm. So how, in effect, is this kind of treatment minimizing harm for people who are, afraid of such
Okay,
treatments?
so with nuclear medicine, when we start with the diagnosis, which is the part that we use very little amount of materials, so this means that there are little amount of radiation. This amount of radiation is guided by a lot of rules and regulations, and in all the departments around the world in Kuwait, we follow certain guidelines, and these guidelines adhere us to certain limit that we should not exceed in order to preserve the radiation to its minimum. Now, when it comes to cancer treatment, we are allowed to reach certain level, and again, these levels are all bounded by guidelines, and we should not exceed them. So we reach to a level where toxic or, let's say, dangerous effect will happen to patient whom we want to treat them. So all the time we are guided by guidelines, rules, regulations that we should not exceed certain limits.
I mean, that's always assuring to hear, right? Especially in state-of-the-art kind of technology when it comes to fixing these kind of ailments. I do want to ask you, because there is something called imaging and there's also something called therapy when it comes to cancer treatments. So what role does, nuclear medicine play into both of these aspects?
So this is actually a very basic idea about nuclear medicine, and this imaging and treatment comes actually from the fact that when we started therapies in early 60s, we selected patients based on what we see.
Yeah.
And then depending on what we see, we design the therapy that will target and goes to the areas that we have seen them by imaging. So this word diagnosis and imaging is something very, very old, but it's re-emerging right now, because now a lot of therapies in the cancer field and cancer treatment field, they are focusing on treat what we see, and we see what we have treated. So this concept is coming back again at multiple levels, not only thyroid, but there is a role of nuclear medicine in prostate cancer treatment. There is a role of nuclear medicine in liver tumors. There is a role of medicine in other also type of therapies.
And that's always comforting to hear. Now, I want to ask you, a patient now has to go through nuclear treatment. So what does a routine session go like? Like, how is that procedure is like?
Majority of our treatment in nuclear medicine, they are based on what we call it an outpatient basis. And outpatient means that most of the time patients do not need to be admitted, stay in hospital for overnight. So it's just a matter of a few hours, maybe sometimes it might reach up to 6 hours. Once the patient, the people who are receiving radioactive materials, they receive the treatment and they reach to a level where it is safe to go outside the place where they have been treated with, then they are allowed to go back home and do their exercises based on certain guidelines. Again, we implement a lot of guidelines depending on the type of treatment that we are going to give the patient.
And it's assuring that you mentioned guidelines twice, because this can lead to my next question, is that how relatively safe is this procedure, or is it completely safe?
It is completely safe. Now, the guidelines that usually deals with the steps that the cancer treatment are being administered to patient, usually they start with therapies, which it might be chemotherapy or radiation therapy, and sometimes they require to give patient a sort of nuclear medicine therapies. And once we reach to that level, these guidelines are being followed according to multiple international societies, international bodies, where they recommend the benefit versus the risk. So sometimes, yes, we do give some sort of radiation, which might be called as risk, but it has some beneficial effects.
It outweighs the negatives.
Yeah, correct. It outweighs the risk that we are going to expose the patient to.
And are there any side effects that are comparable to regular cancer treatments or even on its own?
Most of our treatments, they differ from chemotherapy. The concept is chemotherapy will lose hair, patient will lose hair, patient might become sick, they might experience the treatment session very badly. But with nuclear medicine, majority of the time, the effect will happen very lately. And it's not, at the same time, it's not acute. It doesn't happen immediately like the chemotherapy. And usually our aim of treatment will have these side effects. So for example, if our aim was to target the bone surface, then we might witness some issues regarding to the bone marrow. So that will be followed by the treating doctors who are treating the patient with.
And now also, I did mention before that, because the word nuclear has, a lot of people have misconception about anything called nuclear. But, when it comes to the effectiveness of this treatment, like how effective is nuclear treatment as opposed to, the older methods of treatments?
They are not old, they are still up to date, but the only thing is that each patient have a different treatment schedule. This is what we call the personalized medicine. I don't have one treatment that fits everyone. In medicine, we do have treatments that one patient A might benefit from such combination, patient B might benefit from extra dosage or extra treatment. So these kind of therapies, they will have effect, and their effect will depend all the time on the stage, the clinical condition of the patient that they are being administered with.
And also for being reliant on technology, like what recent advancement in technology like helped and facilitate nuclear treatments?
Well, in the imaging part of the nuclear medicine specialty, a lot of new equipment has been starting the service in the country, in Ministry of Health, Kuwait. These depend on latest technology, a positron emission mammography, which is very commonly called as a PET-CT. This is one machine that we've started the service back in 2008. About 2 years ago, the PET that is combined with the MR machine, the magnetic resonant imaging machine, which is the PET-MR. This is a more recent advancement, and all these technologies will allow us to image the patient and select the proper treatment based on their medical condition.
And so is this kind of treatment, like, is there an age limit? Like, are there people who are too young for this or too old for this?
Again, we will still be following the guidelines. So most of the time, the guidelines will ask us to give treatment for patients above age of 18, but there are certain conditions that we need to administer for lower age. But again, we will follow the guidelines. We will ask the parents' permission. They will have we need to get consent from them. They need to understand the whole picture, why the referring physician, the doctor, selected this treatment as a form of nuclear, and what would be the effect in comparison to other kind of treatment.
Yeah, because I think when it comes to medicine and treatments, it's a case-by-case kind of procedure. It's not everything goes general.
That's true.
I do want to ask you about something. Is this a once in a time treatment, or is it continuous treatment, or multiple sessions?
It's multiple sessions. For example, if we go to the thyroid cancer, we aim to treat a patient once a time. But there are certain conditions that a second treatment might be offered. For treatment with prostate cancer using radioactive materials, this might be for a 6 session. Each session would have an interval of about 6 to 8 weeks. Sometimes we extend, sometimes we bring it earlier. Again, that depends all the time on patient condition.
So what about these specific sessions? Like, how long do they usually take?
A session of a radioactive iodine might take just a pill swallow and a glass of water, and once that pill resides in the patient body for a period of half an hour, everything will go to where the thyroid cancer is, and it will start its treatment. And then we have other sort of treatment that we need to give the patient a time in order to make sure that he received all the medicine. Side effects will not happen with him, which is very common in a lot of medicine. Sometimes patients feel sick, so we need to make sure that they are okay while receiving the treatment. And then once they are discharged, they will have the level of safety in order to mix with public. That might take 4 to 6 hours. So these are the time duration for majority of nuclear medicine.
But from talking about it, it's, I would say, much extensive than chemotherapy, because I know chemotherapy from people that I know, it was very draining. It's very, consuming as well.
It is, it is totally different.
So I do want to ask you, so a cancer patient walks into the clinic, is nuclear medicine, on the table as the first treatment, or is it, you got to weigh a lot of things first before talking about this?
Every patient will be required to go through a lot of investigation. There are many options on the table. The best option will be selected by the treating physician, and again, that will be a risk against benefit. Number one, what are the guidelines based on the stage and the type of cancer that the patient has? And once a nuclear medicine is being selected, there are instances that they might be the first line, for example, in cancer therapies of the thyroid after doing the surgery, or it might be a second or a third option But as the publication are appearing in the world of medicine, these medicine are being brought earlier than before. So about 5-10 years back, they were not approved. Then they slowly started to be approved for certain group of patients, and now that group is being more and more, and the application are being expanded.
Yeah.
So we hope to see more patients in the near future benefiting from nuclear medicine as a sort of therapy.
Inshallah, and I do, emphasize our gratitude and our thanks for you dedicating time out of your day for joining us on the program to talk about all of these issues. So again, I want to thank you for being our guest today, Dr. Abdulredha Esmail.
Thank you so much. You are more than welcome.
Thank you. And dear viewers, that wraps up our segment with Dr. Abdulredha Esmail. All thanks and appreciation goes to him, a head of Nuclear Medicine Department at the Kuwait Cancer Control Center. We're going to take a break. We'll come right back after this one.